The smell of a hospital at 4 in the morning is its own specific language. It speaks in antiseptic and old coffee, in the metallic trace of blood no industrial cleaner ever fully erases from grout lines between floor tiles. It speaks in the hiss of oxygen regulators and the low hum of fluorescent tubes burning through the dark hours, indifferent to the suffering happening beneath them. Sarah Hayashi had learned to read that language fluently. She had learned it in places that smelled far worse, places where antiseptic was replaced by desert dust, and the background noise was not monitor alarms but the percussion of a war that had not yet decided it was finished with her. But that was a different life. Tonight, Ward 7 at Whitmore Memorial spoke to her in the muffled alarm of a detached pulse ox lead, the squeak of a supply cart in the far corridor, and the sharp footsteps of a woman who announced her own importance with every stride she took. Sarah heard those footsteps before she looked up. She was at the medication preparation counter, drawing up a 10 o'clock antibiotic dose with the methodical, unhurried precision that had earned her exactly no compliments during her 8 months on this ward. Her hands moved with the economy of someone who had learned, in context that did not allow for waste, to eliminate every unnecessary motion. The fifth stair belonged to Gloria Trent. Head nurse Gloria Trent had held the position for 11 years and wore those years like armor plate. She operated on the fundamental belief that a ward ran on hierarchy. Physicians at the top, senior nursing staff below that, registered nurses below them, and at the very bottom, the agency nurses, the quiet fillers who came in to cover gaps and were supposed to remain invisible. Sarah Hayashi was supposed to remain invisible. Sullivan chart is late, Gloria said, stopping at the counter without looking at Sarah directly. It was due at 21:30. It is currently 22,004. I was completing Mr. Sullivan's wound reassessment. The packing had shifted. I repacked it and updated the documentation. The chart reflects the delay with a notation. A pause, not uncertainty, calculation. You repacked a surgical wound without notifying Dr. Mercer. Sarah set the capped syringe down. She turned and looked at Gloria Trent for the first time in the exchange. Dr. Mercer left the floor at 20:15. The packing had shifted enough to begin compromising the wound margins. Waiting on him would have taken a minimum of 30 minutes. The patient was awake, informed, and consented. Gloria's chin lifted a precise fraction of an inch. The gesture of a woman whose authority had been carefully circumvented and who could not immediately locate the violation. You are an agency nurse. You are covering a gap. Any clinical decision that exceeds standard nursing scope comes through me or the attending of record, not around them. Understood, Sarah said. I don't think it is understood. What Gloria was looking for was defensiveness, apology, the small reflexive flinch of someone who knew they had overstepped. She found none of those things. Sarah Hayashi had a face built for stillness. Angular jaw, wide-set dark eyes with a quality of absolute unsettling steadiness. There were small lines at the corners of those eyes that didn't belong to a woman of 36. They belonged to weather, to sustained vigilance, to years of scanning horizons that civilian hospital work didn't produce. The Sullivan chart completed and signed by end of shift, Gloria said finally. And in the future, any judgment call outside standard protocol comes through me, not around me. Yes, Sarah said. Gloria held her gaze for one more beat, then turned and walked back down the corridor. Sarah watched her go. She picked up the syringe and walked toward room 712. Her own footsteps made almost no sound at all. Room 718 had been the problem room for 4 days, since Eleanor Voss had been transferred from the surgical ICU following a complicated cholecystectomy. 71 years old, recently widowed, in a state of acute misery she expressed with considerable volume. The real problem was her son. Gerald Voss was in his mid-40s, with the exhaustion of a man accustomed to solving problems with money and phone calls, currently facing one that responded to neither. He tracked every nurse who entered with eyes that had already decided their adequacy. He had not decided Sarah's favorably, On the second evening, when she caught a subtle change in Eleanor's urine output suggesting early acute kidney injury and adjusted the monitoring schedule, he watched with barely restrained impatience before saying flatly, "I want a real nurse, not an agency temp." Tonight, room 718 was escalating. Sarah heard Gerald's voice from the hallway, sharp, carrying the edge of a man who had decided volume was the correct lever for this situation. She increased her pace and pushed the door open. Eleanor was sitting upright in bed, wrong. The head elevation was supposed to stay under 30 degrees given the state of her surgical drain. Her face was a shade of grey-white that Sarah's body recognized before her conscious mind had processed it. Not pain grey, something else. Gerald was on his phone, talking to someone about calling the hospital administrator. Sarah crossed the room in 4 steps. "Mrs. Voss." Quiet and direct. "Look at me." Eleanor's eyes tracked to her slowly. Too slowly. The left side of Eleanor's face had a subtle, almost imperceptible droop. Sarah's world narrowed. Everything. Gerald's voice, the monitor's background rhythm, the distant supply cart, fell away into the specific peripheral silence that her nervous system had learned through extensive and violent education to produce when the stakes became absolute. "Gerald." She cut through his call with a tone that held zero room for negotiation. "End the call, now." Something in the quality of her voice made him do it. Sarah was already at Eleanor's wrist. Pulse 5 seconds, and what she felt made the back of her neck go cold. She pressed the call button twice in rapid succession and pulled the penlight from her breast pocket. Left pupil, sluggish, confirming it. She hit the emergency call override. The door opened. Jamie, the night shift LPN, appeared. "Get Dr. O.C. on the phone," Sarah said without turning. "Suspected ischemic event, room 718, 71-year-old female, post-op day 4. Stroke alert called, and a portable CT ordered before he gets to the floor." "Move." Sarah turned back to Eleanor. "You are not alone," she told her quietly. "I am going to stay right here." Eleanor's right hand reached toward her. Sarah took it. Dr. Raymond Osei arrived 14 minutes after the call. "In IHSS score?" he asked at the doorway. "Estimated 4 to 6. I prioritized getting you here." "Good call. 10 minutes earlier and this goes worse." He moved to the bed. Sarah stepped back into the hallway. Gerald was there, arms folded. "You caught it," he said. "Yes. But the window matters. We're in the window." He didn't say anything else. Graulia arrived at 23:40. She reviewed the chart, then said without looking up, "You initiated the stroke alert before contacting the attending." The call to Dr. Osei and the alert went out simultaneously. The protocol permits either sequence in a time-sensitive neurological event. Mrs. Voss's CT shows a small territory infarct in the left MCA distribution. The early detection window was preserved. She's going to receive treatment tonight. Gloria set the chart down and walked back toward the elevator without another word. It was not an apology, but it was something. The morning brought Dr. Elliot Mercer, 44 years old, board-certified in internal medicine and nephrology, occupying the upper floors of his own self-regard with the ease of a man who had never seriously questioned whether he deserved to be there. He arrived at 07:15, slightly late. Sarah was completing the overnight summary, 19 hours awake. Mercer stopped at the nursing station. He scanned the board and found what he was looking for. Room 718. Voss. Stroke alert initiated by Hayashi, Agency RN. "That's you." "Yes." The alert was called before Dr. Osei was reached. Simultaneously, the documentation reflects. "I can see the documentation." He set the board down with a precise click. "What I'm asking is why an agency nurse initiated a stroke alert without going through the charge nurse or attending physician first." The clinical picture was consistent with an acute evolving neurological event with a narrow therapeutic window. "Any delay." "I know the stroke protocols," Mercer said, his voice carrying the calibrated edge of a man being remarkably patient with someone who didn't deserve the patience. I helped write them. You are an agency nurse. You don't have the authority to unilaterally activate a major alert without senior oversight. Sarah looked at him. Mrs. Voss is in the treatment window because the alert was activated when it was. That is not the point. I think it might be. The specific silence that followed was the kind that occurs when the person not expected to speak speaks directly, without apology, in a context where apology was assumed. Something shifted fractionally in Mercer's space. In the future, he said, voice dropping to the register of practice patients, any time-sensitive assessment on this ward comes to me or the charge nurse first. You, Page, you wait for the answer. You do not operate outside your scope. He moved toward the first patient room. Sarah watched him go. She turned back to the keyboard, finished the summary, filed it, went to check on Mrs. Voss. You were here, Eleanor said when Sarah came in. I was. Last night, when I couldn't make sense of what was happening. You told me I wasn't alone. You weren't, Sarah said. Eleanor studied her with the direct attention of a woman who had lived long enough to see past the surfaces people presented. You're not afraid. Every nurse I've had here looks at the chart. Before they look at me, you look at me first. Rest, Mrs. Voss. She left the room. She had 4 hours left in her shift. She filled them completely, quietly, without ceremony. 11 days later, on a Tuesday afternoon, in full view of the entire Ward 7 staff, the event that broke everything open happened. It happened because of a VIP patient, James Harrington Cole, 58 years old, cardiac arrhythmia complicated by hypertensive crisis. His occupation was listed as business consultant, which meant he was the primary donor underwriting the hospital's new cardiac wing. Dr. Mercer was his attending physician. Sarah knew none of this when she arrived. Room 721 was a corner suite with yellow freesias on the table. James Harrington Cole was silver-haired and compact, watching Sarah with the expression of a man who had not yet decided what category of inconvenience she represented. His blood pressure was elevated above the morning reading. His heart rate showed a new interval variation she noted and filed. She completed the standard assessment, then noticed the IV site on his right forearm. Early infiltration. Tape adhesion lifting at one edge. She was considering options when Mercer came through the door. What are you doing with his IV? Assessing the site. Early infiltration at the antecubital. I was evaluating whether to re-site. Leave it. I'll have the IV team come up. He moved to the chart, flipped through documentation, and stopped. He looked at Sarah. This assessment note from 1443. You documented a change in the arrhythmia interval and requested a repeat ECG without consulting me first, on a patient whose care I have personally taken over. I noted a clinical change and ordered standard diagnostic follow-up. The protocol supports. I am aware of the protocol. What the protocol does not support is an agency nurse independently ordering diagnostics on a monitored VIP patient without my authorization. He closed the chart. Mr. Purdany 4. Harrington Cole, I apologize for this. He looked at Sarah. Step outside. The corridor conversation lasted 4 minutes and was not a conversation. This is the third instance in 11 days of you overstepping your role, Mercer said. The stroke alert. The wound repacking, and now ordering diagnostics on a patient I am personally overseeing. I am requesting a staffing change. I'm having you removed from this ward. Sarah looked at him. Something moved through her eyes. Brief, involuntary, there and gone in under a second. Not anger. Something older. The deeply familiar recognition of a person who has been in rooms with this architecture before. She had survived it before. I understand, she said. She turned and walked back to the nursing station. The ECG result had come in during the corridor conversation. The PR interval change was real. She printed it, wrote a factual clinical note, filed it in the chart, and sent an internal message to monitoring requesting they flag any further interval changes on room 721 for immediate attending notification. Then she went back to her rounds. Gloria found her at 17:15 in the medication room. Mercer spoke with me. He's requesting you be transferred off the ward. I know. Sarah was counting discharge medications for room 716, her hands moving through the ritual of verification. The stroke alert, Gloria said, her voice shifting into something quieter, recalibrating. Was the right call. Sarah's hands paused for exactly 1 second. Then they continued. The ECG result came back this afternoon, room 721, the PR interval. Cardiology is discussing a pacemaker. Sarah set down the medication container and turned to face Gloria Trent. He's going to transfer you, Gloria said. I don't have the authority to override an attending staffing request on this patient, but I want you to know that your judgment on this ward has been sound. More than sound. I haven't always communicated that effectively. It was the closest Gloria Trent had ever come to an apology, and it was not an apology, and it was also genuine. Thank you, Sarah said. Gloria nodded once and left. Sarah finished her shift, changed into jeans and a gray long-sleeve shirt that covered the scar on her left collarbone. She walked out through the ward doors, past the board where her name was still listed on the rotation she would not be returning to. She did not know, walking out, that by morning everything would be entirely different. She did not know the man in room 721 had a son. She did not know his name was Captain Daniel Harrington Cole, United States Navy, and she did not know that Captain Daniel Harrington Cole in 12 hours was going to walk into Whitmore Memorial looking specifically for her. The call came at 0647. Virginia area code. Unfamiliar. Hayashi. A pause, then a voice, male, controlled, with the cadence of someone who had spent years giving information under conditions where precision was not optional. Lieutenant Commander Hayashi. Sarah set down her mug. I've been discharged 4 years. It's just Hayashi. My name is Captain Daniel Harrington Cole. My father is James Harrington Cole, currently admitted to Ward 7 at Whitmore Memorial. I understand you were removed from the ward at the request of the attending physician. Transferred. End of placement. I understand, Daniel said, and the 2 words carried weight that suggested he understood considerably more than the logistical fact. My father's cardiologist called me at 23,000. They found a significant conduction abnormality on the ECG that was ordered yesterday afternoon. He's being evaluated for a pacemaker this morning. The cardiologist said the ECG was ordered by a nurse who noted an interval change before the attending had reviewed the afternoon vitals. Sarah said nothing. Lieutenant Commander, Daniel said, using the rank deliberately. I'm at Whitmore Memorial. I'd like to speak with you in person. I'll come myself, she said. Give me 40 minutes. She arrived at 07:58. Patricia, the day shift charge nurse, said room 721. He's waiting for you. With the expression of someone who had been briefed on a complicated situation. Sarah knocked twice and entered. Captain Daniel Harrington Cole was 31 and looked precisely like what he was, not in surface terms. He was in civilian clothes, but in the way he occupied the room, the way he came to his feet in a single fluid movement, automatic, not performative. The way his eyes tracked to the door before she was fully through it. Assessment. Decision. Stillness. James Harrington Cole was in the bed, looking considerably less guarded than the previous afternoon. Miss Hayashi. Daniel extended his hand. Sarah shook it. Captain. The cardiologist was here at 077. Daniel said once they were seated. They're scheduling the pacemaker for this afternoon. 1st degree AV block progressing toward 2nd degree. If it had been caught 12 hours later, the risk profile changes considerably. He paused. The ECG that identified the trend was ordered by nursing staff yesterday afternoon. Before it was on Dr. Mercer's radar, I documented a clinical observation. The ECG was standard follow-up. It was the right call, he said, a statement of fact, not a compliment. James spoke. He came back in afterward and told me you'd been reassigned. made it sound routine. Daniel tells me it wasn't routine. Daniel tells me it wasn't routine. Mercer had concerns about my approach to patient care. He communicated them through appropriate channels. He had you removed because you ordered an ECG without asking his permission first, James said. An ECG that found the problem, now requiring me to have a device implanted in my chest this afternoon. I've been giving money to this hospital for 6 years. I have a wing named after me in the East Building, and the nurse who caught what my attending physician missed got transferred off my ward for the trouble of catching it. Daniel leaned forward. Your service record lists your last assignment as Fleet Surgical Team 7, attached to Naval Special Warfare Group 2, forward deployed, Kandahar, Afghanistan, 2019 through 2021. The room was quiet. You were a SEAL Team medic, Daniel said. Not a question. I was a Navy flight nurse and forward surgical specialist attached to a SEAL team. The distinction matters. It does, he agreed. You spent 2 years in one of the most operationally intensive medical environments in the modern military. And now you're covering agency nursing shifts and leaving before anyone figures out who you are. Sarah was quiet for a moment. When you stay, she said finally, people build a version of you based on what they see, and they stop looking. I find it easier to work where people don't have a fixed idea of me yet. He reached into his breast pocket and produced a folded sheet of paper. I have a request, not a demand. My unit rotates stateside next month. 2 medics trained and the Fleet Surgical Team protocols that are now 7 years out of date. I'm looking for someone to run a 3-week intensive training block. Civilian consultant contract. Fort Bragg. Housing and transport covered. Sarah took the paper, looked at the number, looked back at him. There's something else, he said. He reached into his other breast pocket and set a small dark velvet pouch on the arm of the chair between them. I was 12 years old when my father got a call from the Naval Hospital at Bagram. My uncle Marcus was serving with Naval Special Warfare Group 2. He took a serious shrapnel wound to the abdomen during a training op, medevaced to the nearest forward surgical element. He paused. The surgeon on duty was unavailable. There was one medic. She performed the emergency stabilization and the conditions the after-action report described as extraordinary, given the operational constraints and the degree of hemorrhage. Sarah was not breathing. My uncle Marcus has 3 daughters. The youngest started college last fall. He nodded toward the pouch. He wanted me to give you that. Sarah picked it up, pulled the drawstring, turned it over. A small silver pin fell into her palm, a caduceus in a specific style, with a small marking on the base of the staff that she recognized immediately. She had seen its twin on the unit patch of every member of FST-7. She closed her hand around it. James spoke quietly. The cardiologist this morning asked if there was anything I wanted to communicate to the nursing team. I told him I wanted whoever ordered that ECG to know I was grateful. He paused. He told me she'd already been transferred off the ward. He looked at Sarah directly. I told him that was going to require some correction. What followed did not happen quietly. James Harrington Cole's phone call to the CEO covered the ECG, the timing, the clinical outcome, the nature of Sarah's removal, and whether Dr. Mercer's transfer decision had been reviewed by anyone above his own authority. The answer was no. The meeting convened on the 4th floor. Greaves, the CEO, Dr. Sandra Okafor, head of nursing operations, Gloria Trent, and Dr. Mercer, who was mid-case when Sarah and Daniel walked in. He stopped speaking. He looked at Sarah, then at the man beside her, and something in the architecture of his confidence registered a significant structural problem. Dr. Mercer, Greaves began, we need to revisit the staffing decision from yesterday afternoon. The decision was made on sound grounds. I stand by it. The ECG she ordered, Gloria said from her end of the table. Quiet, carrying the weight of a woman who had decided overnight which side she was standing on. Identified a conduction abnormality the cardiology team is currently treating as a surgical emergency. The ECG was ordered without my authorization. The ECG was ordered because the nurse observed a clinical change and followed standard diagnostic protocol. The outcome is that a patient is receiving necessary treatment this morning rather than tomorrow, when the progression would have been more advanced. The issue is not the outcome. The issue is process. An agency nurse making independent clinical decisions on a monitored VIP patient without asking your permission, Sarah said. The room went quiet in the specific way that occurs when the person not expected to speak. Yes, Mercer said flatly. Without asking my permission. Physicians direct, nurses support. That structure exists for a reason. It exists for a reason, Sarah said. She was sitting straight, hands folded on the table, voice at its characteristic even pitch. Not aggressive, not defensive, simply direct in a way that occupied more space than its volume should allow. In a standard clinical environment, the hierarchy reflects the hierarchy of training and expertise. I respect that. She paused. But the finding I observed was time-sensitive. The therapeutic window for intervention in progressive AV block is not indefinite. The ECG was not a clinical decision. It was a diagnostic tool. I ordered it so that you would have the information you needed to make a clinical decision. I didn't treat your patient. I gathered information so he could be treated. That is my role. That is what I did. Dr. Okafor said. Dr. Mercer, Nurse Hayashi's documentation is procedurally correct. The ECG order falls within expanded nursing scope for cardiac monitoring patients. There is no protocol violation on record. Her clinical interventions across this placement have been entirely within scope. TA reflects sound, well-reasoned nursing judgment at every point. The silence now was not confrontation but conclusion. Mercer looked at Greaves. Greaves was looking at his own hands. I want this on record, Mercer said tightly. I made a staffing decision based on valid clinical management concerns, and this meeting was convened in response to external pressure rather than any demonstrated failing in my judgment. It's on record, Greaves said, without looking up. Daniel Cole spoke for the first time. Mr. Greaves, my father has asked whether Nurse Hayashi could be present during the procedure this afternoon, not as clinical staff, as a familiar face, given that she is the member of this team who has had the most sustained and attentive relationship with his care. The request was so quietly worded, so procedurally reasonable on its surface, and so thoroughly final in its implications that the room absorbed it in silence. Greaves looked at Gloria Trent. Gloria looked at Sarah. I'll arrange it, Gloria said. The procedure went smoothly. Sarah sat beside Daniel in the family waiting area. At one point, Daniel said, Marcus told me about Kandahar. He said when the medevac arrived, you'd taken a fragment yourself, in the shoulder, but you hadn't called it in. You kept working. He was my patient, she said, very evenly. Yes, Daniel said, he was. The surgeon came out at 15:40. The device was in. The prognosis was excellent. Daniel turned to Sarah. Thank you, he said. Tell your uncle his daughters are lucky, Sarah said. Daniel smiled, real, unannounced. I will. The morning before Sarah's placement was officially due to end. Gerald Voss was standing in the corridor outside room 718. He straightened when he saw her. She asked if you'd be in today. I'm here. I was rude to you, he said. When she was first admitted, I asked for a different nurse. It wouldn't have been acceptable regardless of your background. Sarah looked at him. Not a bad man. A frightened man who had deployed the only tools available to him in a situation none of those tools could address. You were scared, she said. Your mother is getting better. That's what matters. He nodded and stepped aside. Eleanor was sitting up in bed with considerably more color than she'd had any morning since the stroke alert. Her left hand was resting on the blanket, and when Sarah came in, Eleanor raised it slightly, a deliberate gesture, a small demonstration. Better, Eleanor said. Yes, Sarah confirmed, reviewing the overnight vitals. Much better. Gerald told me what you did the night my face went strange. You held my hand. After the doctors came and the alarm started and everything became very loud and fast, you told me I wasn't alone. I remember that. You weren't, Sarah said. Eleanor studied her with the direct attention of a woman who had lived long enough to see past the surfaces people presented. You're leaving this week. My placement ends Friday. And then, I'm not entirely sure, she said. Eleanor nodded as though this was satisfactory and honest. You should stay somewhere long enough to let people know you properly. You move before they can see you. I did the same thing for 20 years after my first husband left. It feels like control. She paused. It isn't. You're very easy to see if someone takes the time to look. I'll come back Friday, Sarah said, to check your discharge paperwork. I'll be here, Eleanor said. The last day brought Admiral Marcus Harrington. Sarah did not know he was coming. She was at the nursing station at 10:15, completing chart documentation, when she heard the elevator. Not the sound of it, but the way the ward changed around it. The subtle collective shift of attention that occurs when someone of significant presence enters a space. Admiral Marcus Harrington was 63 and walked with a very slight forward lean to the left, a legacy of the surgery that had rebuilt his abdominal cavity 14 years ago, though you would have to know to look for it. Civilian clothes, dark blazer, no visible insignia. Two men flanked him who appeared civilian and had, in the way trained observers recognize, the bearing of people whose civilian clothes were currently the only thing civilian about them. Behind them came Daniel, and behind Daniel came Gloria Trent, which told Sarah the visit had been coordinated. Marcus walked the length of the ward corridor and stopped at the nursing station. He looked at Sarah. She had seen photographs of him once, in operational briefing materials. He had been younger, less silver. The same pale gray eyes. Lieutenant Commander Hayashi, he said. I've been discharged 4 years, she said. By reflex now. Automatic. I know, Marcus said. He smiled, small, genuine, arriving from somewhere real. I'd been looking for you for 2 of them. The ward had gone very quiet, not the hush of emergency. The softer, more curious quiet of people who sensed something significant was happening and were trying to understand its shape. Your nephew said you wanted to see me, Sarah said. My nephew has a gift for understatement. I wanted to thank you. He paused. I have 3 daughters, the youngest of whom started college last fall. A wife who put up with 23 years of my career without once asking me to come home early. A brother upstairs recovering from a pacemaker implantation and alive in no small part because a nurse on this ward caught something his physician missed. He held her gaze. All of that exists because of what you did in Kandahar. Sarah said nothing. You were injured, Marcus said. You didn't report it. You worked for 2 hours with shrapnel in your shoulder to keep me stable. You were my patient, she said. You said that to Daniel too. He told me. His expression was patient, clear, gently immovable. That's true, and it doesn't account for what you actually did, and I think you know that, and I think you've been calling it the job for so long that you've half convinced yourself. Sarah was very still. I'm not here to give you a speech. I know you don't want one. He reached into his blazer and produced a small velvet box. I've been carrying this for 2 years, waiting to find you. I'd like to give it to you in person, and then have a conversation about what comes next. He held it out. Sarah reached out and took it. She opened it. Inside, on dark blue velvet, was a navy cross. White and navy ribbon, heavy bronze cross bearing the anchor and the eagle. Below it, folded precisely, a small square of paper. She unfolded it. The handwriting was hers. She recognized it immediately, though she hadn't seen it in 14 years. Younger, less controlled than her current hand, written in conditions she didn't need to consciously remember to recall the feel of. It was the note she had written on torn medical packaging and pressed into Marcus Harrington's hand before the helicopters arrived. Still here? Not going anywhere? You're going to be fine. She had forgotten she'd written it. She held the note in both hands. the medal open in its box on the counter beside her, and she was quiet for a long time. Around her, the ward continued its work. Monitors beeped. Footsteps moved in corridors. Somewhere down the hall, a patient called for a nurse, and the nurse answered. Sarah folded the note again along its original creases. She looked up at Marcus. "You could have mailed it," she said. "I could have," he agreed. "I didn't want to." She looked at Daniel standing behind his uncle, waiting to see how it lands. She looked at Gloria Trent, at the edge of the gathering, with her arms no longer folded but at her sides, open, her face holding the expression of a woman who was seeing something she had not entirely expected. Sarah looked back at Marcus. "You said you wanted to talk about what comes next," she said. "I did. I sit on the advisory board of a joint civilian-military medical training initiative. We've been building a bridge program, taking the advanced trauma protocols developed in operational contexts and integrating them into civilian nursing and paramedic training. The gap between what the military medical community knows and what the civilian emergency system knows is significant." He paused. "The program needs a clinical director, someone who has worked on both sides, who understands both languages. It's not a 3-week contract. It's a program. It has a location, a staff, a budget, and a charter. It has the kind of continuity that means you can't move on when the people around you start to see you clearly." Sarah looked at him for a long moment. "That," she said, "sounds like the hard version." "It is," Marcus said. "It's also the version where the work is worth doing." Sarah set the folded note back in the velvet box beside the medal. She closed it gently, held it for a moment, feeling its weight in both hands. The hard version. She thought about Eleanor Voss's left hand, moving again by fractions. She thought about the note she had written in the dark, on torn packaging, under fire with shrapnel in her shoulder. Not because she was a hero, but because her patient needed to know someone was still there. "Okay," she said. Marcus nodded once. The 2 syllables required no expansion, and he was wise enough to know it. Behind him, Daniel allowed himself a small, quiet exhale. Gloria Trent unfolded her arms and gave Sarah a single, composed nod. Not approval exactly, but something that had been working toward approval for 8 months and had finally arrived. Sarah set the velvet box down carefully on the nursing station counter. She picked up her pen and turned back to her charts. She still had 4 hours left in her shift, medications to administer, assessments to complete, a discharge to process for room 716, and Eleanor Voss to check on one final time before Friday. The work was in front of her. She did it. Some people carry their history like armor, worn on the outside for everyone to see. Others carry it the way Sarah carried hers, pressed close to the body, invisible from the outside, heavy only to the person bearing it. The weight doesn't diminish, but sometimes when the right person looks closely enough and refuses to look away, the carrying becomes, in some small and essential way, shared. Ward 7 was quiet by the time Sarah's shift ended. She walked out through the same doors she had walked through the evening before, when she had believed she was leaving for the last time. She had the velvet box in her bag and the note inside it, and 4 hours of careful, completely necessary nursing work behind her. She had also, for the first time in 4 years, a place she was going. She did not allow herself to feel too much about that yet. But she allowed herself to feel something. And for Sarah Hayashi, that was more than enough to start.